Okay, I haven't scripted this out. I have an important message. I'll just get right into it. So, there's a few things over the last few years that I think very few people could have called out before it happened. And there's a lot of things that I learned too, but when it comes to health, I think the most important thing that we are all missing, it's not what you've heard on TV, and I'm a firm believer that, healthy water, nutritious foods, and healthy habits bring good health, removing your body of toxins, chemicals, and the thing that cause our body, our system to be disrupted, right? Anything that has to interfere with the way our body was naturally intended and designed to live is counterproductive. And we're seeing that. So I'm going to point out the easiest thing that you can do for your body, and this will affect 70 to 90% of people out there. I'm so confident, in fact, that if I knew this information, my father would still be here. And that's actually the reason why I'm sharing this information with you. I want to help you to be healthier by taking control of your health. And that's what this channel and that's what this movement is all about. So in this video, what I want to share with you is the importance of your oral health or your mouth, and just reminding you that it is part of your body. Now, why is this such a big deal? Well, if you're hurting, sick, have some kind of disease, or maybe you know somebody in your family or someone that you love or care about that does. Well, I'll say that I was shocked to know that 70 on the low end, proven, verified, checked by lawyers, but actually evidence is showing closer to 90% of all heart disease and all breast cancer starts from the mouth. But it's not just those two, the cancer and disease, it's all disease, even the mental disease. And we're even finding out, we're learning about the connection more and more, but a lot of those unexplained rare diseases, guess where they're coming from? They're finding the same pathogen floating around in the body that is also starting from the root cause of a silent or hidden oral infection. So if you look at the reason why dental was excluded in the first place, it wasn't ever supposed to be this way for good health. In fact, if you have any kind of reason for pain or to see a doctor, it'd probably be best to skip the normal doctor that you go to and actually visit a dentist. Now, most people don't think about this because most dentists are not properly trained to help you with your health. Now, what does that even mean, and how does that even make sense? What I mean is, we forget that teeth were the fifth leading cause of death in the 1600s. And what we did was we created these dental schools to fast track people. Essentially, instead of going to, a fast food restaurant or, working your way in the entrepreneurial ladder or just going to get a job, like most people do. Instead of that, this was designed to take someone that didn't know anything about being a doctor, health, science, and give them a fast track system because they needed to have as many dentists as quickly as possible. So in other countries, what they do is they actually go through and become a doctor first. They become an MD, a medical doctor, and then they specialize. They go to dental school and learn about that specific area in the body that they're treating. Well, in the US, they took a different approach. And the approach that they took was to just fast track the program. And you see this with, pharmacy, and you see this with x-ray techs. Whenever there is a huge need, a demand that is larger than what they can fill quickly, they need to create some kind of accelerated program. That's very much what they did here. Now, that's one part of it. The other part of it is somewhere along the line, some dental office, because it wasn't always this way. Like if you go to a hospital, you get treated, they don't ask you about your finances, you get a bill at the end, and if you got health insurance, great, but if not, you are stuck with the bill, right? You have to deal with it. In the dental office, some office manager somewhere along the way actually decided to, as a service, do the dental insurance billing for the patient. Now, I'm not going to talk about in this video how dental insurance actually isn't even dental insurance at all, because goodness, it doesn't insure or cover or give you any peace of mind, right, for your health or anything. But getting back to this topic, the dental insurance that was taken in the dental offices was never supposed to be done that way. It was always designed as a supplemental insurance, right? And if you look at the reason why it was taken out of health, it was purely done for political and financial reasons, which is kind of silly when you go back and think about it now, because we spend 2.5 times more in this country per person on their health than any other country. Goodness, we outspend the next, I think it's 9 or 11 countries combined. Clearly, we are losing control of our health, our society, and any chance of reeling this back in the current way that we're going. I mean, we have everybody convinced that they have a chemical deficiency or some sort of deficiency in their body that only a dentist or only a hospital can cure. But everything that we find in history, in the books, because hospitals and this allopathic medicine, which is just a fancy scientific word for doctors that prescribe chemicals and surgery, this is all very experimental. And it isn't proven when you think about the 170 other modalities, proven treatments, time-tested, things that we use not for just a year or 2 or 3 and then say it's tested. These are things that if you go back to China, Korea, Europe, they've used for hundreds, in Africa, in all parts of the different globe, they've used for hundreds, if not thousands of years and more. These are traditions that have been passed down and proven to heal. And instead of understanding how these different modalities worked, they actually just wiped all 170 to make allopathic medicine what it is. So in that process, what they had to do is they had to promote whatever it was most profitable for them: hospitals, heart disease, breast cancer, chemo. It's $80,000 for a treatment, right? And it's getting out of control. They're actually saying that if they continue to do this, Social Security won't be around and Medicare won't be around. I have a solution, and it's a simple one. It's just to pretty much treat the body as part of the mouth and to not ignore the infection or disease in the mouth and pretend that if we use a 6-letter word, the one that starts with D and ends with L, and actually we use that word right now in our society as a reason or excuse to not cover the most important part of our health and our body. I mean, I understand why the insurance companies do it, right? They got to collect as much money as they can and pay as little out. I don't think it's okay what they do to keep it, especially how dishonest they are. But that doesn't mean that it makes it okay for you and for me to not get educated and not demand our dental, not for teeth, for health. I mean, we used to think that teeth were a dead part of our body, and I think that's part of the reason why we ever got into this mess in the first place. There was one time when we just didn't understand the importance of the teeth or the dental health of our overall health. But I don't like using the word dental anymore because it's become a very dirty word. So dentistry is dead. And if you're a dentist, I don't mean your job is going away. And if you're a patient needing help finding a dentist, goodness, I'm actually recommend you should see a dentist, but the right one. So you want to look for a holistic or biologic dentist, maybe the keywords that you're looking for. But in simple English, you're looking for a dentist that actually understands that your oral health and wellness, or your mouth, is the most important part of your body and your overall health. You're wanting to look for a dentist that understands, gives you the options for treatment now. Sometimes you just have a cracked tooth and maybe you just need to, get a filling. But anytime, you have a serious pain or possible comorbidity, which is some other disease in the body that this oral infection may be the primary cause for, right? But we're not doctors. We don't have all of the science. So instead of us trying to figure all that out, this is what we go to doctors for. But don't go to a doctor, because just like the old saying goes, if you're a hammer, everything looks like a nail. And so what I recommend is to go to a dentist. But before you go to a dentist, in fact, before you go to any dentist at all, I'd recommend that you do your research. But if you need help, ask a health planner. A health planner is the first of its kind in this healthcare system. They have it in other countries, but this is a person, a professional in the healthcare industry that works for you as the patient. So they work for me, they work for you, they work for your health and the benefit of you and your best life, not for the profit or some hospital or some shareholder in some corporation. So this gets back to what healthcare should be. And I just want to remind you to demand your dental for your health, because health starts in the mouth. The mouth is part of the body, and you cannot have a healthy body without a healthy mouth. Thank you, and just remember that dental is much more medical than we know. See you on the next video.